Trousseau sign/carpopedal spasm induced by pressure applied to the arm by an inflated sphygmomanometer cuff. AKI, hypocalcemia, involuntary contraction of the muscles. HTN, hypertension. Chronic kidney disease. Acute glomerulonephritis. AKI category C intrarenal. Bladder outlet obstructione. AKI category C postrenal. NSAID. The first mechanism of acute kidney injury from NSAIDs is due to reduced renal plasma flow caused by a decrease in prostaglandins, which regulate vasodilation at the glomerular level. AKI category C parenally. Muscle cramping. Large amount of fluid off during your dialysis treatment. Hemodialysis complications. Dystryptomyces. The transition from high levels of toxins, electrolytes, and fluid in the blood to lower levels following dialysis can trigger arrhythmias, irregular and potentially dangerous heartbeats. Hemodialysis complications. Acute glomerulonephritis. AKI category C intrarenal. Primary glomerular diseases / that is glomerulonephritis. Why? Chronic kidney disease causes. Why? Gynecological. K. AKI category C postrenal. Calculi. AKI category C postrenal. Exposure to nephrotoxic drugs / amphotericin B. Why? AKI category C intrarenal. Diuretics. Diuretics can also contribute to AKI by causing hypovolemia. AKI category C parenally. Dehydration. AKI category C parenally. Sepsis. AKI category C intrarenal. Primary glomerular diseases / that is glomerulonephritis. Why? Chronic kidney disease causes. Why? increase RR and depth compensation. Chronic kidney disease, HTNO plus and H2O retention, malfunction of renin-angiotensin-aldosterone seisme. Complications of ESRD, end-stage renal disease. Bone disease. Elevated phosphorus levels leads to decreased calcium levels, abnormal vitamin D metabolism. Complications of ESRD, end-stage renal disease. Azotemia. Azotemia is an elevation of blood urine nitrogen/BUN and serum creatinine levels. Acute kidney injury filiary. Ischemic nephrotoxin injury. Kidney common causes /3 categories: parental, internal, postrenal. Y. Hypotension. Hemodialysis complications. Air embolism. Hemodialysis complications. HTNO plus and H2O retention, malfunction of renin-angiotensin-aldosterone seisme. Complications of ESRD, end-stage renal disease. Azotemia. Azotemia is an elevation of blood urine nitrogen/BUN and serum creatinine levels. Acute kidney injury filiary. Ischemic nephrotoxin injury. Kidney common causes /3 categories: parental, internal, postrenal. Y. Neuromuscular abnormalities. RT electrolyte imbalances, hypocalcemia, involuntary contraction of the muscles. Acute kidney injury filiary. Hyperplasia. AKI category C postrenal. Kidney damage or decrease in glomerular filtration rate over a period of 3 months or more untreated leads to end-stage renal disease/ESRD. Chronic kidney disease. Uremic skin color/yellow-green. Y. Chronic kidney disease. Nausea and vomiting. Dialysis disequilibrium. Y. Acute polynephritis.
Pyelonephritis is a type of urinary tract infection, UTI, that generally begins in your urethra or bladder and travels to one or both of your kidneys.
AKI category C intrarenal. Abnormal phosphorus high and calcium levels low, increased serum phosphorus and decreased renal production of vitamin D. Chronic kidney disease. Nausea and vomiting. Dialysis disequilibrium. Abnormal phosphorus high and calcium levels low, increased serum phosphorus and decreased renal production of vitamin D. Chronic kidney disease. Nausea and vomiting. Dialysis disequilibrium. Y. Fosdick sign/twitching of facial muscles in response to tapping over the facial nerve. AKI hypocalcemia, involuntary contraction of the muscles. Fatigue. Chronic kidney disease. Possible seizures. Patients with uremic encephalopathy may present with seizures. Acute kidney injury filiary. Increased BUN creatinine. Acute kidney injury filiary. Damaged kidneys must work harder to remove phosphorus from your body. Buildup of phosphorus is associated with less calcium in your blood and with the release of PTH by your parathyroid glands. PTH moves calcium out of your bones and into your blood. The loss of calcium can harm your bones. Elevated phosphorus levels leads to decreased calcium levels. Hyperkalemia, decreased excretion, metabolic acidosis, catabolism, excessive intake VDD. Complications of ESRD, end-stage renal disease, nausea and vomiting. Acute kidney injury filiary. Increased BUN creatinine. Acute kidney injury filiary. Nephrosclerosis.
Hardening of the walls of the small arteries and arterioles, small arteries that convey blood from arteries to the even smaller capillaries of the kidney.
Chronic kidney disease causes Y. Anemia, CBC/RBC5, hemoglobin HbG15, hematocrit HCT45. Chronic kidney disease. Scissor. Dialysis disequilibrium Y. Hypertension E. Chronic kidney disease causes Y. Hypovolemia. AKI category C parenally. Bladder K. AKI category C post. Decreased level of consciousness. Dialysis disequilibrium Y. Hypertension E. Chronic kidney disease causes Y. Bladder K. AKI category C postrenal. Oliguria, anuria, kidney oliguria, urine output less than 0.5 milliliters per kilogram. Kidney anuria, decreased urine output of less than 50 milliliters in 24 hours. C. Chronic kidney disease. Prostate K. AKI category C postrenal. Vomiting diarrhea. AKI category C parenally. Anorexia. Acute kidney injury fillery. AKI inhibitor C. These medicines can also decrease glomerular filtration by causing vasodilation of the efferent renal arteriole. AKI category C parenally. Electrolyte imbalances associated with electrolyte and acid-base disturbances such as hyperkalemia, metabolic acidosis, hypocalcemia and hyperphosphatemia. Acute kidney injury fillery. Uremia, a buildup of toxins in your blood. Chronic kidney disease. Vomiting diarrhea. AKI category C parenally. AKI inhibitor C. These medicines can also decrease glomerular filtration by causing vasodilation of the efferent renal arteriole. AKI category C parenally. Uremia, a buildup of toxins in your blood. Chronic kidney disease. Vomiting diarrhea. AKI category C parenally. Fluid retention. Acute kidney injury fillery. Oliguria. Acute kidney injury fillery. Pericarditis, cardiac tamponade, retention of uremic wastes, inadequate dialysis.
Pericarditis is swelling and irritation of the thin, sac-like tissue surrounding the heart, pericardium.
Complications of ESRD, end-stage renal disease. Headache. Dialysis disequilibrium Y. Metabolic acidosis, hyperkalemia. Acute kidney injury fillery. Weakness. Chronic kidney disease. Intratubular obstruction. AKI category C intrarenal. Fluid retention. Acute kidney injury fillery. Intratubular obstruction. AKI category C intrarenal. Fluid retention. Acute kidney injury fillery. Uremic frost. Chronic kidney disease. Dialysis disequilibrium, range of neurologic symptoms. Hemodialysis complications. Cholesterol embolism. AKI category C intrarenal. Fecal impactione. AKI category C postrenal. Liver filiary. AKI category C parenally. Uremic feeder/urine-like breath odor, metallic taste in mouth. Chronic kidney disease. Cardiac filiary. AKI category C parenally. Dialysis disequilibrium, range of neurologic symptoms. Hemodialysis complications. Cholesterol embolism. AKI category C intrarenal. Confusion. Confusion means that your brain is not getting adequate blood supply. Acute kidney injury filiary. Anemia. To get the marrow to make red blood cells, the kidneys make a hormone called erythropoietin, or EPO. When the kidneys are damaged, they may not make enough EPO. Acute kidney injury filiary. Restlessness. Dialysis disequilibrium. Y. Diabetes mellitus. Y. Chronic kidney disease causes. Y. Shocky. AKI category C parenally. Benign prostatic. AKI category C postrenal. Exsanguinatione, extensive blood loss. Hemodialysis complications. Aminoglycoside ABX/ that is gentamicin, tobramycin. Y. Nephrotoxic. AKI category C intrarenal. Radiocontrast-induced nephropathy. AKI category C intrarenal. Anemia, decreased erythropoietin production, short RBC life cycle, blood loss during hemodialysis. Complications of ESRD, end-stage renal disease. Metabolic acidosis, hyperkalemia, kidney phyllo 7.35-7.45, kidney HCO3, low 22-26, low bicarbonate levels / less than 22 mol/L. Chronic kidney disease. Elevated BUN and creatinine, kidney blood urine nitrogen 10 to 20 mg d-li, kidney creatinine 0.7 to 1.4 mg d-li. Chronic kidney disease. Electrolyte imbalances, hyperkalemia caused by decreased renal ion excretion. Chronic kidney disease. Fluid retention. Chronic kidney disease. Metabolic acidosis, hyperkalemia, kidney phyllo 7.35-7.45y, kidney HCO3y low 22-26y, low bicarbonate levels / less than 22 mol L. Chronic kidney disease. Fluid retention. Chronic kidney disease. Fluid retention. Chronic kidney disease.